Good morning and welcome to House Call, the show that helps you live longer and stronger. New this week, cancer death rates are on the rise. So what's going on? We have a doctor on the front lines who's going to give us the reasons, and more importantly, tell us 3 things we can do today to help prevent cancer. Also in the news, a troubling reality. In another year, cancer could surpass heart disease as the world's #1 killer. That's according to a new international report. Experts say by 2030, there will be 27 million new cancer cases worldwide, 17 million deaths due to cancer, and 75 million people living with cancer 5 years after their diagnosis. One major culprit has been tobacco and remains tobacco. Something has to be done about this. 1.3 billion people around the world smoke, officially making tobacco the #1 preventable cause of death. Now, another headline that caught my attention from that report: last century, 100 million people died from using tobacco. This century, 1 billion are expected to die from tobacco unless something changes. These numbers are so startling, something so preventable. And joining me to be able to get into these new cancer numbers, Dr. Otis Brawley, head of the American Cancer Society, my friend as well. Thanks so much for joining us.
My pleasure.
You do such a good job putting some of these numbers into context for us. My understanding is the numbers across the globe are increasing, yet the numbers in the United States are decreasing. What is going on? Is this an access issue?
Well, what's happened is all the bad habits that we have in the United States, smoking, diet, and other things, we're exporting them outside of the country. They're going to third world countries as well as to middle income countries. Now, more than 40% of all smokers live in India and China. That wasn't true 20 years ago.
Well, what is helping here in this country now?
We've gotten the word out about cancer control. Smoking rates have been going down for 40 years in men, for about 30 years in women. We're doing a lot better in terms of diet and exercise. We're doing a lot of things, and yes, incidence rates are actually going down in the United States. Mortality rates are going down in the United States. But as we look around the world, we're going to have an epidemic of cancer.
You travel all over the world in your role now with the ACS. What is the relationship in terms of deaths, from cancer deaths to other chronic diseases?
Well, let me tell you, a lot of people think about infectious diseases a lot. If you sum up the number of people who die from HIV/AIDS, from tuberculosis and malaria, sum up those 3 diseases, cancer kills more people. Cancer as a chronic disease is a major problem. By 2010, we estimate that more people are going to die from cancer than cardiovascular disease. Many of the reasons why they're going to die are preventable. It especially involves around smoking.
You've talked about the simple things, relatively simple things people can do now. If you had to come up with the top 3 list of things people could do to try and bring these numbers down, what would they be?
Well, first off, if we could get rid of tobacco use altogether, that would help us a great deal. Second thing, after getting rid of tobacco use, I would say that we need to start looking at diet and exercise, and everybody needs to try to get as close as possible to ideal body weight. In the world as a whole, responsible sexual practices would be number 3. In the United States, where we have a very good healthcare system, I'd like to get people into that healthcare system and stress some preventive aspects of medicine.
You know, it's interesting. People ask me all the time as they ask you if they're diagnosed with cancer, what to do, where to go, who to see. Is there a disparity of care within the United States? I mean,
tremendous disparity of care within the United States. The quality of care received can vary by region. It can vary by area of a city. You know, in North Georgia, for example, we have evidence that 7% of black women who are diagnosed with early-stage breast cancer get no treatment beyond the diagnosis. It's 2% of white women. They all have poverty and disenfranchisement in common.
Well, Dr. Brawley, some good news, some bad news obviously in here, but always useful news from you. Thank you so much.
My pleasure.
We're going to keep on cancer, talk about it a lot. You know, it's an interest of mine and an interest of yours as well. I should point out as well that you're one of our experts now on our newly minted website, cnnhealth.com. This is something we're really excited about. It's a chance for you to connect with a lot of your fans and viewers here at home and around the world. So thanks so much again for that.
Thank you.
Really appreciate it.